Have you struggled to afford healthcare due to the high costs that continue to rise and create detrimental impacts in your life? Imagine this: you are sick or have a life threatening emergency, but you are unable to seek medical help due to not being able to afford healthcare, so you must suffer. As for me, healthcare is an essential to live healthy mentally and physically. As for I've experienced my own struggle with needing quality healthcare, but was not able to receive that when I needed the care due to high cost. Having access to affordable healthcare can enhance someone's quality to life. I will focus on the need to change the problem of overpriced healthcare costs in the U.S. and its call for action to make healthcare affordable and the resulting consequences of our actions. In order to address the need to change the cost of healthcare, I will first discuss the need to the action to the problem, then the solution to the issue, followed by the results and consequences. I will begin today by explaining the need for action for rising healthcare costs in the U.S. In America, healthcare costs are rising at an alarming rate and are overpriced. We need to take action. This controversy is devastating for Americans' paychecks and health, and we must put a stop to it immediately. According to Disease Management and Health Outcomes, costs are breaking the bank for citizens, and the expenses can include unaffordable premiums, debt, and copays. The U.S. is showing several signs and effects from this problem, such as debt and death rates increasing in its citizens. For example, according to Debt, Americans are spending thousands of dollars of their paychecks in healthcare expenses. This has led to more debt in this country every single year. It is so important to change because of the detrimental impacts it can have on America's affording essentials and citizens' health. The extent of the problem has gone as far as people avoiding visits to doctor's appointments just because of the copay's cost. This leads to poor health of its citizens. According to National Health Expenditure, statistics state out-of-pocket costs for healthcare grew from around 2.6% to $365.5 billion. This is extremely unaffordable, racking up a debt. According to Americans' Healthcare Cost Crisis, experts Shelley and Timothy A. Lash say the average cost of a hospital stay has grown by 600%, which is in fact 5 times faster than the average price of a new car. The elderly and adults to low to middle class are most affected by this problem. According to healthcare spending, statistics states elderly people are in need of healthcare the most. This will increase the healthcare cost to 20.1% of the GDP by 2025. This is outrageously unaffordable for citizens. For example, many elderly people are avoiding paying for healthcare, insurance, or medications because of the cost, leading them to sacrificing other essentials in their life. Given the need for action for expensive healthcare costs in America, we can now move on to the solution for this concerning issue. By reducing cost of healthcare premiums and eliminating copays, we can alleviate the stressors for low-income citizens through a petition. A plan to eliminate healthcare visit copays and reducing health insurance premiums through taxing the wealthy will alleviate stress from individuals who cannot afford it. This solution satisfies the need to change overpriced healthcare by ensuring there are no extra costs in copays and affordable premiums, which will help reduce the costs in healthcare and not break the bank or mental health for lower to middle class citizens. This solution can be implemented by signing an online petition. Everyone and anyone can take action by signing the online petition supporting this plan to be taken and proposed in Congress. First, we can construct the new action plan and raise taxes for the wealthy. Then we can sign the online petition. Finally, we can take the proposal to Congress. First, by constructing the new healthcare plan, we ensure positive benefits for every individual and sign an online petition in support of this change. Next, after we have the support for this new plan to change healthcare costs, we can propose this petition for immediate change in Congress. Now that you've heard the solution for the rising overpriced cost of healthcare, next I will share with you the expected results of our plans and consequences. Imagine yourself not having to worry about if you can afford dinner tonight or a trip to the doctor's, and having to decide what to sacrifice each week and how much debt you have built from healthcare expenses. The expected results of this solution are to have cheaper health care and insurance for America's lower to middle class citizens and the elderly, as our health is essential. We can expect to see our citizens with better health and a thriving economy in our affordable health care. Consequences, if action is not taken, can lead to more debt for lower class citizens, increased death rates of the elderly, and people can stop paying for health care altogether. Finally, now that we have heard the expected results from our actions and consequences, we can now wrap things up with our final call for action. Healthcare and insurance in the U.S. are overpriced. It is an essential, such as food in our lives, to survive. Why should we have to choose between our health and essentials to survive? In conclusion, the controversial problem of overpriced healthcare costs that face the U.S. is a call for action to reduce the cost, making it affordable for all citizens, and we can expect to see positive benefits from our actions. If no action is taken, we can suffer the consequences in our health and economy. No person deserves to suffer from overpriced healthcare. This plan for action will not only benefit us now, but also in the future. So why wait and let it get worse? Let's take a stand and make a change for not only ourselves, but others in need, and seek to change the rising cost of expensive health care. We must take action now. Thank you.